Hello, everybody. This is Melinda Roy. I'm the host of the second day WYN Croatia Summit 2022. So, welcome our speaker, Ashley Vihore. Hi, Ashley. How are you doing today?
I'm doing well. How are you?
I'm doing great. Thank you so much that you are being a part of the WYN conferences as a speaker. So, before you start your session, so let's play an audio. So an introduction audio of yours. Okay, once it is completed, so you can start and your session. Okay, enjoy your day.
Absolutely. Thank you so much.
Thank you. So Ashley, so we have a problem with playing an audio. So let me introduce to the WIN conferences. Okay. So yes, Ashley Vihore, she has been a family nurse practitioner for 5 years and registered nurse for 11 years. She is currently working on pursuing another advanced degree. She currently practices in a skilled nursing unit as a physiatry nurse practitioner in Memphis, Tennessee. Her main focus with patients is assisting them in rehab and physiatry medicine, adjusting to their new normal and staying motivated to accomplish goals. In her spare time, she is a mentor with young girls at Kita's place, enjoying spending time with family and community service with Mesoros with Omicron Sigma Alumni Chapter of Sigma Gamma Rho Sorority Incorporated. So this is the introduction of Ashley V. Harvey. Thank you so much. So actually, you can go ahead and you can present your start your session. So, are you presenting any PowerPoint?
Yes, I am prepared to share. We ready to go?
Okay. Yes.
All right. Let me get it on the screen real quick. 1 second. Here it is. Can you guys see my screen?
No. It is
Okay.
still showing as presenting to everyone. So, could you please check your network issue?
Sure. Let me click it
I can see that
again.
you have a low bandwidth. Yeah,
You
it is
can.
presenting now.
Okay. Oh, it is? Okay. Well, there we go.
We cannot see your presentation.
Okay. My apologies. I clicked it too fast there. Here we go. It is circling for me.
Between nice hairstyle.
There we go.
No, we cannot see your presentation.
Okay. It's still circling. I had it up just a second ago. 1 second.
Okay, no problem.
Okay. There it is. Share.
So just click on this present to audience, this arrow button. So yeah, you can go ahead and you can present your screen.
Okay. And I'm going to go ahead and have
Yes,
it
yes, it's
pulled up.
working. It's
Okay.
working with you.
Excellent. All right. Well, let's go ahead and get started then.
Yeah, it's still loading.
Is that okay?
Yes, yes, yes. Go ahead,
Okay.
please.
All right.
Thank
Well,
you.
I'm Ashley Harvey, and let's talk about recognizing changes in condition with patients sooner. Okay. So, as a physiatry nurse practitioner, like she mentioned before, I do work in a skilled nursing home. So, I will definitely talk about the elderly or the geriatric population a lot. I love the elderly. It is definitely a passion of mine, and I definitely feel like we can learn a lot from this particular population. So, um, particular conditions that I see personally myself, urinary tract infections, no matter how old you are, young, old, in between, it's something that we all battle. Sometimes you know exactly what it is, sometimes you don't know what it is. Some interesting facts that I came upon: 25 to 50% of geriatric patients can be diagnosed with a UTI. You think about that, the amount of patients that are out there, and over half of them potentially could have a urinary tract infection. That is definitely major, it's huge. When it comes to the cost, you have to think about how would you treat the patient. Would you treat them in an inpatient versus an outpatient type situation? If they're having to be hospitalized and require antibiotics, fluids, lab work, all of that, the low end of that could be $5,000 or more. So when it comes to us as nurses, as a nurse practitioner myself, I encourage all nurses to be more proactive when it comes to catching these particular ailments quicker, so that you can, help your patients save money. Things are expensive nowadays, groceries and everything else. So we need to save money however we can. And medications is not on a lot of patients' minds as far as affording, like that's not at the top of their tier of things that they need to afford. So with that being said, something as simple or complicated as a urinary tract infection can legit, if it can be prevented, we definitely want to do that. When it comes to nursing, I try to tell them, when I hear the question, how often should I, let you or the doctor know when I think something is going on, if they have a urinary tract infection or something like that. I tell them my answer is the same all the time: as soon as possible. It's never too soon to let me know. The sooner you let me know, the sooner they can be on the road to recovery. At that point, they're not having to suffer or be miserable from that infection, from the urinary tract infection. So let's talk about some signs and symptoms when it comes to urinary tract infection. I always tell them, what would you look for when you are going in the room as a nurse? Personally, if the patient is saying, it hurts when I pee, like it kills me when I have to pee. Or, for instance, let's use the name Mr. Brown, for instance. Mr. Brown, when you come into his room and he's saying, oh my goodness, I pee 10 times a day. Well, today I feel like I'm peeing twice as much. What is going on? Urinary frequency is definitely I feel like it is a definite missed physical symptom when it comes to urinary tract infection, simply because, especially in the geriatric population, people just automatically say, well, they just pee a lot. Not necessarily. Don't just write that off as the patient pees a lot. Urinary frequency is a sign of a potential urinary tract infection. Abdominal pain and flank pain. This is something that may not necessarily show up in the beginning, but as days roll on and it's not treated or diagnosed, this may be something, as you know, us as nurses, you would definitely see, ooh, my belly is hurting today, or ooh, I got low back pain or flank pain. It is just killing me. These could all be symptoms of a urinary tract infection. Changes in condition when it comes to urinary tract infections. This can happen whether you're in the younger population or the older population. Confusion. They, may know who you are today, and if their urinary tract infection really kicks in by day 2 or 3, they may not know what day it is. They may not know, who you are or where they are. Behavioral changes. This is huge in the geriatric population. For instance, the patient, Mr. Brown, all of a sudden says, hey, hey, such and such, how are you? Very nice, very kind man. Instantly, as soon as that urinary tract infection kicks in, his behavior swaps. He's aggressive. He wants to fight you today. He doesn't know who you are. These could all be symptoms of a urinary tract infection. Lethargy and sleeping more. Let's talk about those. Those are huge. In an older population, for example, when they say, oh, I am just sleepy today, I cannot get up, I have no energy. Most people write that up as, well, they old, honey, they'll be all right, just let them sleep. Not necessarily. You have to go back and ask, well, what else is going on? Are you going to the bathroom more? Are you hurting anywhere? Ask those questions. Don't just write off that a person just is the way that they are based off of their age. Ask the questions. That will lead you to the answers, so that way you're able to let the person that you need to know, that you need to inform, to help them with that. Secondary symptoms can include loss of appetite, fever, again, abdominal pain, dark or foul smelling urine. This is one that's huge also. You want to make sure, I know some people go, ooh, I do not look at the color or the smell of urine. You might want to. It could be an early indication that you have a urinary tract infection trying to creep in. Look at your urine, and I don't necessarily, put your head in there to whiff, but definitely keep an eye on it. If it smells funny, that could be an indication that a urinary tract infection is creeping in. Now, these last symptoms, a lot of times, these are later symptoms. At this particular point, they may need higher level of care. Like if they're in the nursing home, they may need to be hospitalized. If they're in the clinic, you may need to see them for next day follow-up. Elevated heart rate and low blood pressure. These two are major. These are both symptoms of possible sepsis. Sepsis is something that can advance when a urinary tract infection is not treated in time. You do not want to wait with any patient to the point to where their heart rate is in the 110s, 120s, 130s. Their blood pressure is 90s over 70s, 90 over 60s. You don't want to wait to that point to let someone know that, hey, they're not doing well today. And an elevated blood sugar, especially if they're diabetic. A lot of times patients that have blood sugar issues or that they are diabetic, it will let us know that when their blood sugar starts to rise, that something is off. Infection is there, and we need to figure out where it is and treat it ASAP. So let's talk about some treatment options for urinary tract infections. If you're taking the conservative route when it comes to the patient, giving them additional fluids. Now, those fluids Please, please, please let them be water. I can't tell you how many patients have told me as a nurse as well as a nurse practitioner, ooh, I do not do water. Please, we have to do water. Our body is made of mostly water. We have to respect our body and drink the water. Even if we have to change it into lemonade or something like that, water is our friend. You definitely want to avoid triggers such as acidic drinks, sodas, pops, anything caffeinated, coffee, stuff like that, and alcoholic beverages, because that, of course, can entail, it can literally negatively impact your kidneys. And when you have a urinary tract infection, you're trying to help your kidneys. You don't want to hurt them any more than they're already hurt at that particular point. Now, I always put on here proactive measures simply because you want to be proactive, not reactive. Things that you can do to prevent a urinary tract infection: probiotics. Please consult your physician or nurse practitioner. A lot of probiotics are over the counter and they're really good. Um, Daily antibiotics. This may be something that your physician or nurse practitioner decide to do. You continuously have urinary tract infection after urinary tract infection. But in my professional opinion, it's definitely not something that I would jump to simply because it builds your resistance to certain antibiotics. And you don't want that. You want, when you do have one, you want them to give you medicine and it work. You don't want to build resistance. So you want that to be like one of your very last options when it comes to proactive measures. And emptying the bladder when the urge is felt. That is huge. How many of us can truly say we get up to go use the bathroom the first time our body says, I need to go? I'm going to put my hand down because I know I do not. I will hold it, and I will be one of those that will be guilty to say, I sometimes am running to get to the bathroom because I wait to the last minute. We need it. We need to stop that. We definitely want to go when the urge is felt. Don't keep waiting and letting that urine sit there, because that could potentially lead over time to a urinary tract infection. Aggressive measures such as IV fluids and antibiotics, um, by mouth, IV, or intramuscular by a shot. I did name a few here: Rocephin, Keflex, and Levaquin. Levaquin in severe cases can be used for a UTI. And of course, the sooner it's treated, recovery can begin. And that's huge right there, simply because the longer you wait, the longer your body is going to take to recover from that particular infection. Moving on to pneumonia. This one right here is huge. As we get ready to go into fall and winter, these numbers were just mind blowing to me. 1.5 million people have been diagnosed with pneumonia. Now, we are currently living in a post COVID slash maybe still in COVID type situation, and pneumonia was actually, unfortunately, one of the additional things that happened with COVID. So the cost to be hospitalized with a actual active pneumonia in your body is $10,000 or more. And these costs are rising because, as you know, healthcare is forever changing. And, between the specialist cost and lab cost and, x-rays and imaging, everybody has to get their piece in. And that's where the cost, it just shoots right on up. And of course, as soon as you as a nurse even think that your patient has pneumonia, you need to notify, your immediate supervisor or your physician or nurse practitioner ASAP, as soon as possible. So let's talk about some signs and symptoms of pneumonia. You guys, chest tightness and chest pain are probably one of the top two that I hear when it comes to diagnosing pneumonia at the bedside. They say, "Oh, I just feel this stabbing pain or this burning pain to the side of my chest that won't go away." And it just hurts me so bad. And I feel like my lungs, I just can't get them open. Congested cough. You will hear, as some people say, a popping cough or a congestive cough that they just cannot get rid of. Some people are actually, where they cough up stuff and it has color to it as well. These could also be symptoms of pneumonia. When it comes to changes in condition, when a patient is confused, that lets you know that the pneumonia is worsening. Dyspnea or shortness of breath is a huge one. That lets you know your patient is starting to decline pretty quickly. When they start getting short of breath, you need to move as a nurse. No one wants to be short of breath. I personally have had pneumonia and it is the worst feeling ever. No one wants to be short of breath. When your patient is short of breath, they are immediately uncomfortable. It is our job as nurses to do our patient and let the provider know, hey, something is going on. I need XYZ. Lethargy and unresponsive. If you can't get them up, if they are unresponsive, this has turned from, well, let me tell someone to, I need to move really quickly. Your patient at that particular point is going to need a higher level of care. Do not wait to the next round to do something about it. You definitely want to be proactive at that point. Get people on the phone, get help in the room, and get them comfortable and out of the building, preferably to a hospital or a higher level of care. Loss of appetite and a fever. These particular two don't necessarily always present fever in some cases. Some people, of course, will tell you, I never run a fever. So if those particular people are running a fever, then that is definitely an indication that it could be pneumonia, especially if they're having some of the other symptoms that were listed. Crackles on exam or infiltrates on a chest x-ray. So crackles, what I always tell people, if you have a fresh bowl of Rice Krispies and you put the milk in and you hear the little crispy, the little pops going, if you listen to a person's lungs as a nurse and you hear that particular sound in their chest, this is what we call crackles on an exam. These could be possible signs that they have pneumonia. When a patient has a chest x-ray, a radiologist will let us know that they have a right lower infiltrate or a left lower infiltrate or bilateral infiltrate. Infiltrates are significant for pneumonia. That lets us know the patient has pneumonia. Elevated heart rate and low blood pressure, two major signs of sepsis. This means the patient is really sick and you need to move very quickly. Remain calm, but your top priority is taking care of that patient and making sure that they get what they need done, and that's to a higher level of care. Decrease O2 saturation. If your patient normally runs 99 to 100, 98 or so, and today they're running 90%, 88, 87, under 90%, definitely an indication that the body is struggling with keeping up with what it needs. You will need an order for oxygen, which is our next one, their need for oxygen. If they're telling you, I'm short of breath, and you're checking that number and it's under 90 and you need a level, to grab them some oxygen, once you get the order, this is definitely an indication that possibly they could have pneumonia. I always explain to family members and stuff that ask me, pneumonia is a sign that the body is just, it cannot keep up with what the current need is. So here's the treatment options for pneumonia. You want to push fluids and decongestants like Mucinex and Robitussin for the cough. However, these are needed in instances if the patient has like a mild cold or a mild sinus infection that's not including fever and other stuff like that. If they've been diagnosed with pneumonia itself, you're going to skip the conservative option and they're definitely going to get more of an aggressive option, even if that means by mouth antibiotics or a shot of antibiotics. If they are sicker than that, then they would definitely need some IV fluids and some IV antibiotics, azithromycin, or the Z-Pack, as most people know it as, doxycycline, and then Levaquin is a heavy hitter in severe cases. It's a great option. Steroids, and a neb treatment or a nebulizer and an inhaler. These are all options that are going to help actually work to open the lungs up. This is major. And oxygen, they'll definitely need that on their road to recovery. So that way, basically, the body itself is not having to work as hard. It can recover and not struggle. Next, our let's talk about falls and subdural hematomas. Man, this is a major one. Look at the particular statistics. 36 million plus people are falling, and it's being reported each year. 1 in 4 adults. Now, you think about that. Seriously. 36 million people. Now, you think about it. Mr. Brown or somebody else that perhaps lives in the community, and they say, girl, I fall 3-4 times a day, but nobody knows. You think about all those falls that are not reported. That's a lot of falls. To be hospitalized, especially if you need surgery after a fall or you're diagnosed with a subdural hematoma, look at this price: $55,000 to $401,000. That's for one hospitalization. That is huge. I mean, you think about that. If you fall and break something, you're going to potentially need surgery from an orthopedic surgeon. Or think about it. If you are on the higher range towards that $401,000 and you have a subdural hematoma, neurosurgery as well as neurology is going to need to come in. These are highly, specialized people that are coming in and evaluating you and potentially cutting on you and doing surgery. Everybody wants to get paid. Unfortunately, the patient is going to be billed for that. And if you have a patient that has fallen or you think may have a subdural hematoma, you need to let someone know as soon as possible. I mean, absolutely immediately, as soon as possible. So let's talk about some signs and symptoms of falls and subdural hematomas. So, the first one is obvious. You see the patient on the ground and you trying to figure out how they got there. Chances are they fell. And this is so unfortunate. They are disoriented on the ground. They have fallen. If they happen to get themselves up, you come in the room, they got unexplained bruising, swelling, bleeding, little knots. You start, as the nurse, you should ask questions. Mrs. Such and such, how did you get that? What happened? Tell me what happened. You got yourself up. How long do you think ago that was? And then you'll start to investigate as the nurse. You'll want to start asking the questions of who was the last person to see the patient, what's going on. Let me call the doctor, the nurse practitioner, to report to them. If you come into the room and you see that, the left leg is over here and the right one is over here, but the ankle is twisted, yeah, it's a definite injury. And you definitely want to get them to the hospital as soon as possible. In those particular instances, when joints and bones are out of place and you can physically see them, you do not want to move the patient. You want to call EMS and they will let you know how to proceed as far as getting them safely off of the floor. Confusion, worsening headache. Let's talk about those as far as physical symptoms with a subdural hematoma. So, someone that is normally not confused starts to be confused. You start asking the questions. Do you know who I am? Do you know where you are? Do you know what day this is? Not all at one time, but give them time to respond. And if they have confusion, it's definitely time to do a more thorough assessment, including getting blood pressure and stuff like that. So, worsening headache. If the patient says, oh my God, this is the worst headache ever that I've ever had in my life. it's definitely time to start getting vital signs such as blood pressure, heart rate, oxygen, and start doing a more thorough assessment with them, listening to their lungs. Um, Personality changes. If they go from being super nice to all of a sudden combative, aggressive, wanting to fight you, or let's say the total opposite. They were aggressive at first and now they're super nice. That's a huge personality change for them. You definitely want to go through the questions of asking them, are you okay? And orientation questions like, do you know who I am, where we are, and all of that. Sleeping more, drowsy. With falls and secondary symptoms, increased pain, elevated blood pressure. If they're hurting, their blood pressure is definitely going to be up without a shadow of a doubt. Increased confusion. And then for subdural hematoma, nausea and vomiting. If they have made it to this point, then we are towards the emergency aspect of subdural hematomas. If they're having nausea and vomiting, you want to definitely get vital signs with them and call the doctor or the nurse practitioner ASAP. Low blood pressure or unable to keep them awake. If you're having to go, hey, wake up, and they are not waking up, you need to call for help and get someone on the phone to get them to a higher level of care, preferably with a neurologist as well as a neurosurgeon present. So let's talk about treatment options for falls and subdural hematomas. You definitely want to assist them off of the floor after the initial assessment is negative. What I mean by that is you want to make sure nothing is hurting them, nothing is out of place as far as bones and joints on your initial sweep. You want to make sure you're able to get blood pressure and heart rate. A fall mat can be an intervention that is conservative, especially in nursing homes, if everyone on the team deems that necessary. And a toileting schedule. If you notice that the same person is falling because they're trying to make it to the bathroom, then coming every 2 hours may not necessarily work for them. You want to make sure that you're going right after they have a meal. Hey, Mr. Brown, can I take you to the bathroom? Offer to take them, because Mr. Brown is going to die trying to go to that bathroom. 9 times out of 10, if he realizes, well, I got my light on, I'm waiting, but they ain't came yet, he is going to get up and going to die trying to get to that bathroom. Proactive measures, I kind of just touched on that quickly. To check on patients every 2 hours and offer assist. You want to make sure, honestly, if a person is falling before that 2 hour mark, that you're going to them a little bit more often. I understand we're all essential workers and we are exhausted. However, we want to do our part to help prevent that hip fracture, prevent that femur fracture, or prevent, that brain injury. Go that extra mile and go to that room and offer to help them. When you're in the room, make sure their items are in reach before you leave. If you're getting ready to leave and Mr. Brown's water is clear across the room, Mr. Brown is going to die trying to get that water, because most people are independent. It's just in our nature to be independent spirits. So make sure they have what they need before you leave. So that actually kind of helps in the aspect of preventing the fall. Aggressive measures. If the patient is going to the hospital, 9 times out of 10, if they were on blood thinners when they fell, a CT of the head is going to be ordered. You want to make sure that they don't have a bleed to the brain. If they're complaining of pain in a particular location, then 9 times out of 10, an x-ray will be ordered to rule out hairline fractures, dislocations, or any fractures or breaks. Now, transfer to the hospital and an eval per a neurologist as well as a neurosurgeon for possible surgery with a subdural hematoma is suspected is considered a medical emergency. I'm going to repeat that again, a medical emergency. That's not something you want to sit on. So if you honestly think that they've had that changing condition and a lot has happened and it's just going downhill very quickly. You want to get them to the hospital as soon as possible. And EMS is definitely going to transfer them to not only the safest or the quickest hospital, but one that is going to have neurology as well as a neurosurgeon on deck in case they need to do a burr hole or something to relieve the pressure from that subdural hematoma. And as I kind of wrap it up, one of the main takeaways that I want everyone that is listening in to me this evening is with the right tools, you as a medical professional, even if you're not at the bedside, I hope that something that I have said has the power to make a difference in each patient's life. We should all be proactive, not reactive. And just some of my references. All of my information came from CDC this evening. And I'd like to thank you guys so much for tuning in, listening to me discuss recognizing changes in condition sooner. So if you have any questions or concerns, that's my personal email. Feel free to reach out to me with any questions and concerns that you may have.
Thank you so much for your. It's I really enjoyed your presentation. Your presentation is not only for elderly, but also useful for younger generation as well. Thank you so much. And here is the question from our audience. So, so, what is the most common cause of an urinary tract infection? Hello, you're on mute. Ashley, you're on mute. Ashley, you are on mute. Can you hear me? Ashley, can you hear me? Can you hear me? You are on mute. You're on mute. You're on mute. Please unmute. Yes.
How about now?
So here is the question from our audience. So, what is the most common cause of a urinary tract infection?
Ah, yes. So probably one of the most common that I personally actually come in contact with is people are actually wiping the incorrect way. That's how bacteria is getting in. Instead of front to back, they're actually wiping the other way, which is causing bacterial to come into the urinary tract.
Okay, thank you so much for the information. So I really thoroughly enjoyed your presentation. Thank you so much for being a
Absolutely.
part of this WYN conferences as a speaker, and have a great day. Bye bye.
Thank you. Bye bye.
Bye. So before we jump into the another session, so I want to play a video of our upcoming conferences. So and I will come back with the surprise after the video. Thank you so much. Hello, everybody. I hope you have watched this video. Yes, recently we have organized a New York event physically, which really went wonderful. So, if you want to see the speaker testimonials, you can visit our Facebook page when conferences, and and we do have upcoming conferences as well, which is going to happen on November 3rd and 4th in Dubai, UAE, and February 23rd and 24th in Paris, France. So, if anyone has any interest to participate for this conference, so if you want to participate for our future conferences, I can give you the best surprise. So, if you want to register with us, so it is we can give you 10% discount if you register by before September 30th. I repeat, if you want to register for our future conferences, we can give you 10% off. So this offer is valid up to September 30th. 30th, that is 30. Thank you so much. So let's jump into the another session.